We're joined by a special guest, Miss Nori. I kiss my cats every day, several times, because, as I tell them, better than people. Anyway, we're going to talk about GLP-1s. That's right, the semaglutides, the tirzepatides, and what you should do if you're going for some procedure or surgery where you need general anesthesia, because this has become quite an issue. And some people, some surgeons, some anesthesiologists are denying people, go play, go enjoy life, go ahead, baby. And what you should do about this. Here's the thing. In JAMA, in March of this year, there was a study showing that in people that were taking, they didn't say how long, but were taking these tides, like tirzepatide and semaglutide, these weight loss drugs, these GLP-1 agents, that when they looked at the sonogram in their stomach, that 56% of them had a lot of food still in there, and people that weren't taking the drug was only 19%. And the fear is, and there have been some case reports, that people are going to aspirate, they're going to vomit during general anesthesia, and it's going to go down the wrong pipe, and you've got a big aspiration pneumonia. And so a lot of anesthesiologists and surgeons are scared about that, and they're suggesting that you stop it for 1 or 2 weeks before. Now, fast forward, and I'm going to quote a number of societies, and it says that most patients may continue safely taking the glucagon-like peptide, those GLP-1 receptor agonists, as prescribed before undergoing elective surgery or endoscopies. Okay, and that statement was a joint statement on October 29th from the American Society of Metabolic and Bariatric Surgery, the American Society of Anesthesiology, the American Society of Perioperative Care, Obesity, and the American Society of Gastrointestinal and Endoscopic Surgeons. So what do you do? Well, ultimately, it's the decision of the anesthesiologist and the person doing the procedure. I see pre-op patients. I'm just the cardiologist. But ultimately, it's the responsibility of the anesthesiologist and the surgeons, because I can approve it. If they don't want to do it, they're not going to do it. And this is an important thing for anyone taking these drugs. You know, sometimes there's a shortcoming in these pre-op evaluations, and you may not see the anesthesiologist till seconds before they put you under. That's not the right way to treat the patient. You have to contact the surgeon and the anesthesiologist and tell them you're taking one of these drugs, and they need to inform you and tell you what their decision process is. Okay? That's the important thing. Again, there is an associated increased risk of stomach contents and potentially risk of aspiration, but then again, here's the statement from all these societies saying that the risk is minimal. I hope that helps.